Can I sit or stand? Something
As you prefer.
Is it convenient to you to do that?
Thank you, Professor. I am Ramji Sapotka. I am student of the American University of Sovereign Nation. I am studying Master in Bioethics and Global Public Health, MBGPS. Now I am going to defend my thesis entitled Environmental Effects on Immunization Problem in Baglung districts in Nepal. Now Baglung district is located in province number 4 in very rural districts. As partially fulfillment of the requirements for master degree. Okay. May I start now? Yeah? Okay, thank you. Okay, abstract. Immunization is a public health measure for protecting a long number of children from infectious disease. A cross-sectional study was conducted to determine the environmental factors affecting on an immunization program in Baglung district of Nepal. A total of 297 purposefully selected respondents were included in this study. Among the respondents, 44% were of Janjati. Janjati means indigenous, like then 28% were Dalit and 27% were Brahman Kshetri. Of them, 80% were belongs to age group 21 to 30 years. 66 had 1 to 2 child and 33% had 3 to 4 child and 25 had more than 5 children. By education, among the respondents, 23% were illiterate, then 45 had attending primary school and 24 had secondary level of education. Among the respondents, two-thirds of the respondents were farmers and 15% were housewives. By family type, 65% come from a nuclear family, and by economic status is 39% were moderately poor and 25% were poor. 20 were sovereign and 60% were of ultra poor status. Among the subjects, 42% were of the 12 to 15 months age and 30% were of the 60 to 20 months, and the rate were of the 21 to 23 months age. Among them, 55% were male and most of the respondents, 84% live in hilly areas. About 77% of the respondents was to come the immunization center of food, by food. By destination of the 3 hours from center, 72% were within half of the hour of walking distance, 27% within 30 to 60 minutes, and 26% were within 1 to 2 hours. Study children received the BCG vaccine 95%, DPT and OPV first dose 91%, DPT first and second, and OPV first and second 86%, DPT 1, 2, 3, first, second and third, and OPV first, second and third is 76%. 76% receiving the measles and 76% receiving full vaccination. Among those who could not vaccine properly, 33% were due to the landslide and 28% due to the flood, 11 of the sickness of children. It is the recommended that immunization program implementing agency should have cross-plan to cover hard to reach areas, even affecting districts. This is table of content. Okay, this is table of content and chapter. Just I go the Nepali national. This is background. Background is this. Okay. Immunization is a public health measure issue or protecting a large number of children from infectious disease. They save and million of the life each year. Each country immunization their population to. This was then. Okay, here is a global status and in our country status. The immunization coverage in Europe, Western Pacific and American regions have over 90%, whereas in the Southeast Asia and Africa regions have nearly 60% and 66% respectively. But in our country, our WHO estimated the immunization or 2.5 million deaths every year in all age group from this disease, like diphtheria, tetanus, and measles and other. And then Nepal national status is the national coverage of vaccine of the fiscal year 2016, like Nepali year 72, 73, now 74 this year. So that the routinely immunization coverage of all antigens in the thoughts in trend in 2007 compared to fiscal year 2016 to 17 to overall immunization coverage of the last 3 years given below. This is this is government of Nepal fiscal year 2015-16 annual report. I reference is this. In Baglung districts, where I research and study in Baglung districts, those national and international target of EBI is to reach more than 90%. The trend of regular immunization coverage in Baglung districts has been low and has always been lower than targets set by the Department of Health and Service. Justification: the UPI is proposed public program of government of Nepal and is one of the target of MDGP for the target of regular vaccination is Baglung district since the last 3 years is in dressing. There has also been lower immunization coverage than the targets set by the Department of Health Service, and then national coverage of Baglung districts Then this is the research questions. What are the geographically and environmental factors affecting immunization program? Where in a research study objects, two types of objectives, general objectives and specific objectives. The general objectives is determine the environmental factor of effecting immunization program in a Baglung district, and specific objective is to explore the status of immunization coverage among children aged 12 to 23 months in a selected BDC. I select 6 BDC to estimate the geographical and environmental issues affection in influencing in immunization service, to find out the social demographic characteristics of the respondents. This is the conceptual framework. Here is immunization status, complaints of the resource of the incompetences. Then social demographic factor, there is sex and age, child age or mother, occupation, education, like then geographical and environmental factors, type of studies area, communication, distance, like this, variation, climate change, variation. Then immunization status is BCG, DPT, polio, measles, jaundice, encephalitis or other. Here is a literature review. There are some data and okay, this is in a research. This is important thing, points. Study design, studies duration, studies area. As in a study design, the study was cross-sectional respiratory survey. Then study duration is 1 year, 2015 to 16. Then study area, I already mentioned, Baglung districts. This is located in province number 4. Here has a 6 BDC. In this research, then population, the study population where the mothers having minimum on children of 12 to 20 months age. Sampling framework. The sampling framework compares list of the household from BDC. Inclusion criteria is children between the age of 12 to 23 months of either sex, where include if a household has more than one eligible child, only one was selected randomly. Those responded who were signing in the area of the last 12 months of more were included in the study. Exclusive situation is responded that desired the study subjects and out of the study areas, and respondents who were severely sick and mentally retired. I explored this situation. This is a sample. This is a sampling size. This is a formula. This is universal. Using, I think, in a research, in this type of research, this is universal use formula. Then sample size is 296 sample size. Technique, proportionally sampling method was adopted for this study. data collection tools and technique. Pre-tested structure questionnaire. I asked them question, then they give an answer in a responded. This is the data collection tools, then data analysis. And then major point is ethical consideration. I asked my university, IRB board, then they give me a ethical approval in university IRB board, then DHO, district health organization. This is the government body in a districts. I also there goes to one ethical approval, then verbally inform the parents who responded, who before I asked the question, they give me a verbally ethical. Limitation of the study. The limitation of this study will be the maternal belief. This is chapter 4. This is the finding. Okay, here is some table. This is finding. Its table is responded ethnicity. There is Brahman Kshetri 81 household. There is 27.4% Janjati. 130 responded is Janjati ethnicity group. This is 43.9%. Dalit 82. Percentage is 27.7. Muslim 3%. Responded is 1%. Then total sample is 296. Then respondent mother age is below less than 20 years, 30 mothers, then 10%, 10.1, 21 to 30 years is 237, this is 80.1%. Then 30 plus is is 29. Responded is 9.8%. Then number of children 1 to 2 age 195. This is 65%, 65.88%. 3 to 4 97 children as 27 to 32 to 32.77%, and 5 plus is 4 children is 25.3%. Like education level, please see 66 has been 23.3%. Primary school 133. This is 44.9%. Then secondary level goes school secondary level 72. Responded is 24.3%. Higher education only this is 25 person who is 8.4%. Occupational in Nepal also agriculture country like 202 person is involved in agriculture. This is 68.2%. Business 23 people is in a business 7.8%. Labor 4% is 1.4%. Also have 45. Then in a percentage 15.2%. Service means government or private 18 people is in a service, responded in a service. This is 6.1%. Others 4%, 1.4%.
Go on a bit faster.
Okay.
Just the
Okay.
main response.
So this is another age characteristics. Here is a slide in a table. You is 6. There is this is a ethnicity or caste, joint family or nuclear family. Then this is a status of the economic condition status. Then geographical status. I think this is hilly areas. 248 people is in live in hilly areas. 83.8%. This is a big percent. So in our hilly country, there is a environmental effect. So plain area, only 14 people responded is hilly plain areas, mountain and river side areas. There is a transportation also by foot, cross the bridge, cross the river, public transportation. How many responded is coming up? Immunization center. This is the data. Location of household, cluster are in a district. This is a time how much time we came immunization center. This is a time frame. This is the vaccine provide. Which vaccine? This is immunization status of the respondent. This is respondent immunization data. This is the cause of the how to not go there to take a vaccine. Flood, heavy rainfall, landslide, then other things, sickness, other problems, disease. Here is a factor, environmental factor and non-environmental. 66% is environmental effect, then 32% is a non-environmental issue. They does not go there. This is our government national immunization schedule. I think internationally something is changed, but similar in our child group. Okay, here is a conclusion. Here is a conclusion. Among the respondents, more than 40% were Janjati. More than a quarter were Dalit. This is a conclusion. Okay, here is a recommendation. On the basis of the finding, the study recommends the immunization program implementing agencies should have plan to overhead or reach area even after disaster, and the government should expand the immunization service in all its facility in all days with properly recording and reporting system, finally, the government should also operate the public awareness program to run the immunization program more effective. Here is a reference. This is a reference. This is a question. This is question. Respondent name, address, BDC or ward number, social demographic characteristics, ethnicity, and there is a caste, Brahman, Kshetri, Janjati, Dalit, and others. Age of respondent, mother age, number of children of do you have? What is the education status level? What is your major occupation? How many months do you have for? This is the economic status. Geographically, location, hilly, plain area. This is the geographical characteristics. What is the transportation they used to go to immunization center and house to immunization center? They used to walking or cross bridge and public transport. To time duration, also here how many time, which vaccine. This is a vaccine name. Okay, finally, thank you. This is my research. And then finally, at last, I would like to thanks to all respected person who encouraged and support me during my study. So many thanks for Professor Darrell Messer, then AUSN family, university family, then my president, Youth UNESCO Club, Mr. Ramesh Khanal, then General Secretary and Vivek Adhikari, Milan General Secretary, Rajendra Khadka, and Milan Youth UNESCO team, Vivek Adhikari, Dirmal, Ajit, Anmol, like others, my brother, and finally I would like to my family also who support me in the research indirectly or indirectly. Thank you so much. This is my thesis. Thank you so much.
Thank you, Ramji. Thank you, Ramji. Thank you, Ramji. So, I think we may have some questions or comments.
Not some, many.
Many? Okay, good. So, you're going to take a note of all the questions because as you... and good morning to all those who came late.
Very good morning.
Good morning. Wearing the right T-shirt just to try and get an excuse for being late. Thank you, Rajendra. Good.
He's a graduate, so.
He's a graduate. Okay, good.
So you get it once you graduate?
Yes, if you're lucky. So thank you very much for your work, Ramji. Please make good notes of all the comments. And we're also making a video of this, so you won't forget things. I suggest you go back to the summary of your thesis, and Hassan has some questions to start with. He has several pages written down. Okay, so
He has written thesis.
he's written a thesis about your thesis. Okay, so maybe go to the conclusions part is fine, and then recommendations. That's good to okay. So Ramji, get ready for your pen and paper. Hassan, please.
Yeah. Anyway, I start with a few. First of all, I mean, it's just a suggest. I think you need to give it to some.
Use the microphone, please.
Well,
Use the microphone.
as I said, I mean, there are so many things.
Turn it on.
Okay. I mean, the first thing I think you should do, leave alone the content. I think try to get somebody to clean up the document because there's so many grammatical mistakes. If at all you want to publish it, unless you want to keep it yourself. One. And the second thing, perhaps you just went through the stuff there. I really don't understand what is the problem. Can you tell us what the problem is? Especially, when you write a dissertation, as I was telling one of your colleagues the other day, you need first of all to define your variables. For instance, issues of immunization, issues, what do you mean by environment, especially the relationship between the variables. Because I don't see, you did not tell us clearly what is the relationship between immunization and environment. I didn't see that one. So you need also to define your concepts, both operationally and also conceptually. If you saw that day when David was trying to tell us what is bioethics, he tried to define the concept bioethics by telling us conceptually the love of life. And then operationally he gave us examples, including coincidence that there was this celebration, this ritual we had here. I mean, in other words, you need to define your concepts so that anybody who does not understand what you are trying to research, he knows, when you talk of immunization, we mean this. First of all, you did not even tell us what are the people being immunized and who is being immunized, the children or everybody. That is also another aspect. The second and another important, I think, is besides the conceptual issues, is the methodology. I mean, you did not tell us, you said you selected 296 respondents, isn't it? Purposively. You did not even explain why was the sampling purposive. Why was it purposive? That is also need to be explained. Why the sampling procedure? And also you go on saying it is a quantitative study. You wanted to, it was descriptive study. But you need also to explain what makes your study descriptive. The fact that you put so many figures there does not necessarily make it descriptive. And when you bring issues of environment and immunization, which have not been justified, you need also to explain. The purposive sample, you usually take a purposive sample because you assume those are the people whom you want to give you information. They have the right information for the study. But you must also know that when you do a purposive sampling procedure, which is a non-random sampling procedure, if you know those issues also, probability and probability sampling procedure, but purposive because in a probability sampling procedure, every element in our population has an equal chance of being involved in your study. And when you do a non-probability sampling procedure, in other words, purposive sampling or accidental sampling, or they are part of non-probability sampling procedure, you target a particular group. If you go, for instance, to a hospital and you want to only focus on matrons, any other nurse is not part of, because we say I am targeting matrons, because you think perhaps those matrons are the ones who have the right or who have the appropriate knowledge to give you. But those things need to be explained. And also another aspect, I think let me stop there, then we can continue.
Okay, so Ramji, can you explain your methods a bit more? Where's show the thesis, your methods section. Thank you, Hassan, for the
And also,
clear
another-
points.
can I add something there?
Okay, you can add while he's finding the methods. Go ahead, Hassan. Yeah, point number 4 then.
Yeah, and the same thing on methodology. But you need also to explain, you give the socio-economic demographic characteristics of your respondents in terms of age, ethnicity, and all of the other variables there. I think you also need to explain why do you need those variables, socio-economic demographic characteristics, and what is the relationship between those variables and the research problem. What is the relation between ethnicity or the age group, educational levels, with the problem of the impact of immunization on the environment or vice versa. That needs also to be explained.
Okay, so Ramji, can you explain more on the methods, please? Using the text that you have. You can sit down. Please sit down.
Thank you, Professor, for your questions. First of all, my mother language is Nepali. My English is not so good, so some grammatical mistake. I think I'm so sorry. I correct these. Then, okay, you asked me what's the actual problem to relation immunization and environmental effect. I think in our country, here is some environmental effect in the like flood. Then the child the child are not goes to immunization center. They miss his vaccine in a schedule. So this is the actual problem. And another, okay.
And why you choose that district particular? What's the criteria? Why not any other district?
Yes, this is the question. This district is middle of Nepal. One of region is middle of Nepal, Baglung district. Then this is so many hilly and mountain area in this district. And another thing is there is so many effective environmental cause of environmental effect in all year. Some days in a seasonal environmental effect. There is a climate change problem, there is a flood and landslide, and this is the rural area of Nepal. So I choose this district.
This is the only one.
No, not the only one, other also is.
So why not that? Why not another?
There is in a government data, there is so a child not use vaccine, not to take vaccine in environmental issues. So I choose this district.
Yeah, maybe. Yes, okay, well, you have a mic, so Dr. Selvanagam first. Sorry. I thought you were
So, primary question is, what is your objective? Objective of your work. And number two, what has been done so far in Nepal about this work? Have you got any literature? Similar work has been done in Nepal or elsewhere. No, have you gone through review of literature?
What makes your study different from other studies which you already done?
See, normally any work, first review of literature, objective, review of literature, then based on the review of literature, we will form what is the need of the work in that particular area.
Exactly.
There is this chapter 2 is all the literature review was not presented. Yeah. Yeah.
And then, how your work is going to be helpful to your government or world health organization or whatever it may be, and health front. And then you are talking about environment and immunization. What are the factors actually you think that it will affect immunization? You said flood. Flood is a general term. Drought is a term. But you said climate change. These are all big words. But when you come to the immunization, it's a process in which you are applying vaccine. So how the environmental factors affect this process? Right? Then you also mentioned about the Brahmin, Dalit, this and that and all. What way connected to the immunization process? Is there any specific reason for identifying the group of people? Maybe Dalit may be indifferent towards vaccination, the Brahmins may be more knowledgeable or awareness, so they would like to go for the vaccination. So anything related to that? And finally, what is your recommendation? Because that is a very important one. After having done all this work, what is your contribution to the society? Who will be the beneficiary of your work? See, only when it's useful to the community, to the agency, whatever you have done will become waste. So you should be able to give pinpoint 1, 2, 3, 4. So these are my recommendations. This will follow, then this will show the improvement in this area.
Let me ask, and then he can.
Okay,
answer.
Maya, you have comments? Yeah, go ahead. Thank you.
All right, Ramji, well done at least for presenting. I think maybe I'm going to try and help you to maybe connect some of your issues together. Professor Kaya mentioned socioeconomic characteristics, age, gender of the mothers that were interviewed. And then the first question before that, he asked, how did you come to choose those particular group of women? And you mentioned you wanted purposive sampling because you wanted to look at mothers that had at least one child, and that child must be of a certain age group. And that age group will allow for that children to have had a certain number of vaccines by that period of time. All right? Okay. You also mentioned that that particular region or district in your notes, the category as per the government has categorized that region or that district as not being complying with the immunization success. You said something about category 3 or something like that in your data. What you are not able to do is link each of these bits of information with the findings that you've got. For example, Prof mentioned socioeconomic characteristics. You mentioned age of the mother. These women are at the working age. Right? They are 21 to 30 years of age. And you mentioned out of your 296 of the women, 68% of them were farmers, which means 201 women are farmers. If they are a working age group and they're in the farm and immunization is today during working hours, I'm not going to have a chance to go and immunize my child because I'm a farmer. You can even link that with something you mentioned in one of your findings, absence of mothers. You had a category there, absence of mothers, as one of the reasons why someone indicated why they cannot go to immunization. Absence of mothers on the day of immunization is because they are working in the farm and they are in that age group. They are supposed to be working. You, as part of your methodology, you indicated that these are some inclusion criteria and some exclusion criteria. And that's how you selected these women. But in your exclusion criteria, I found it, maybe you need to reconsider the beliefs and attitudes of the women. Because as Prof is explaining, if someone, you can now link that, if someone is of a certain belief system, they may decide that we have a belief that this vaccine is not good for us, or this vaccine is going to lead to death, or our cultures do not allow us to. These are some of the environmental, not the geographical or biological environmental things, but these are other environmental factors that you can consider as to why people may just decide, I do not want to go. So maybe the exclusion criteria is something you need to reconsider, including. Because that information, you had an open-ended questionnaire, somebody may have explained that information, they may have given you that information at some point. So you need to quickly check and see if they have given you that kind of answer or explanation for that. So I'm saying you're going to miss. So this linking of all your tables of data together, if the women of a certain age group, they were absent, they were of this ethnic, particular cultural group, what does all of those things mean for immunization, as Prof is saying? Other things like environmental. You mentioning there's a geographical description of that district is hilly. Does it mean that the immunizations are there, the facilities are there, the effective immunization vaccines are there, but the people are just not getting there? Or are you saying that the environment, the mountains around there are not, and the floods and the landslides are not allowing us to have a fixed clinic there? The facilities, there's irregular electricity, there's irregular, so the fridge is going off and the vaccine is dying. I think maybe even the center that's there, the clinic that is providing immunization, are they discussing with families the real benefits of the vaccine? Are they able to get there on a regular basis? So yeah, these are some of the things I'm thinking. Maybe a focus group. It doesn't have to be going back and interviewing all of the people again. Just bring a group of people, 5, 6 to 12 women, bring them together and just ask them these questions so that you can get that information quickly again, if you need it, if you don't already have it. And you might find they'll all agree, yes, this is the reason why we don't do this. It's too long for us, we can't miss work, and this is why. So yeah, that's from my side.
Can I add something?
Yes, Ramesh, you can. Please sit at the table if you're adding something. Or you can stand. You can stand.
Okay, sure.
Yeah.
So thank you for the presentation. And I think regarding the environment, I think there are certain beliefs in our society, and I think the ethno-medical belief that people have, I think, and the education of the family, and especially the fathers and mothers who have never been immunized. So I think that can also be the factor. And I think in the environment we can also add the timely vaccination system. And I think a child can miss some of the vaccination procedures and he can't go because he might think that I have already missed the first one. So they will not go to the second one. And then they will start replacing the immunization dates. And also, as you have told that working areas that family has, and the geographical disadvantage that people have. The location of the health service might also affect many people. Normally the government put their health services in place where they have an easy access to road, so that they can travel here and there. But the people, they live in different places, so I think the place also sometimes plays an important role in immunization. And basically, education, as I've already told, is one of the factors, because the family has not been immunized in their lifetime, and they don't want their children to go. And there are certain cases where they have like side effect of immunization as well. Children get sick after the immunization, and I think that is one of the leading cause that families do not want to send their children to the immunization center. So I think this can be one of the environmental factors that we had. I think it's socio-economic factor.
Okay, Ramji, back to you for.
I want to just.
Let Ramji reply.
Okay.
A lot of the answers are in the thesis, so you just need to show the. But you have
Thank you,
about
Professor Silvana,
9 or 10
and
points to go
thank you, Professor Maya and Ramesh, and both of you so many suggest and give an answer also. I so thank. Professor Sivanayam asked what's the recommendation? Recommendation is in a government.
Can you show your recommendations
Okay.
when you answer the question? Can somebody help to go scroll through quickly, please? We're using Word file as I requested.
In our country, some vaccine is given in a year, one time or two time. So in this season, there is some environmental problems. So I recommend the in a vaccination agency, immunization service, who those who provide the immunization service. The government should expand the immunization service in health facility all a day. With proper recording and reporting system. When the child goes once immunized, this day, another day, he easily got vaccine. This is the, and another thing is public awareness is a big problem. We've already remains mentioned in our cultural some problem in this situation public awareness is the major issue, so we award the public to get a vaccine in your child, to give a vaccine in your child.
Okay. Next, can you next go explain the research questions? Okay. You have on page 12. You've got all the things they answered. They just haven't looked at the presentation when you showed it. Okay. So you just need to explain based on your thesis. So for everyone watching, please learn from the lessons of how to do a thesis defense, how you could improve the thesis defense, because you may be in the hot seat next. Vikesh will be in the hot seat next. But page 12. So go to page 12 first. You were asked specifically your research objectives, so you've written it down. So please read. General objectives, specific objectives, what are they? This is a question that was given to you.
Okay, to determine the environmental factor of affecting immunization program in a Baglung district, this is the general objective. And then specific objectives is to explore the status of immunization coverage among the children aged 12 to 23 months in a selected BDC of Baglung districts. To the geographical and environmental issues influence immunization surveys. To find out the social demographic characteristics of the respondent.
Okay. Now my question is, these are the three objectives. Did you find solution or some answer for this question and included in the conclusion?
Okay? So you come back to the conclusion because he has to go to the back. Go to the next page. The conceptual framework was a question asked by Professor Hassan.
So whether you found the answer for this and is it included in the conclusion and recommendation?
Okay. Next, what's your conceptual framework? Please explain. This was a question Professor Kaya asked. Why do you have different factors to include? So please explain why you have these and why you exclude other things.
There is socio-demographic factors: sex, age, children age, mother occupation, education of mothers, family size and type, incoming ethnicity is the demographic factor, social demographic factor. Then geographically or environmental factor is type of studies area, communication. There is a communication in a health service center or public peoples and social. Then climate variation, social variation, climate variation. This is the geographical and environmental factor. Then immunization status. This is the provide the government BCG, TPT, polio, measles, Japanese encephalitis. This is the exactly in a schedule, government schedule. Some vaccine is provide hospital facility center. Then some is campaigning the place to place. They carry the vaccine in a vaccine carry box. Then there is some problem. So if vaccine available in a hospital center, then today he any cause he do not goes to vaccine, take a vaccine, then another day he easily got a vaccine. This is the major problem.
So how many years did you do the work working in the with the Ministry of Public Health in the villages on immunization? It's a number of years. Yes, so how many years? 10 years?
Yes.
How many years did you do this type of work?
I have?
Yeah.
Okay. In 10 years.
Yeah. So that needs to be explained as a background because they think you just went to do the research, but he's been working for the government for 10 years. So based on that experience, I found these variables to be the most important to identify in my study. Okay, so that's the answer to the question.
One small question.
Yeah.
See, you talked about the transport facility of vaccines to one place to other place, and also problem if it's available in the hospital itself or the primary health center or whatever, maybe it will be easier and all. My question is, when you take up this set of vaccine immunization program, how do you do? Do you go to different places like railway station, bus stop, and other places like schools and all simultaneously same day you do that, or you have fixed different days in different places? That's number one. Number two, Is it done in a particular day in all the places or different days? Since the children are very early age, it's not school going children mostly. That means parents has to be there. So is it clubbed with the holidays? Because most of them you said farmers or people who are working. If that is the case, then they may not ready to sacrifice the working day for the sake of vaccination, because they will lose their one-time wage. So is it possible to have it Saturday, Sunday like that, so that people will be free and they can take up vaccination?
In a Nepalese situation, farmer is all 7 days work in a farm. Because there is some economic condition, they do anything, they take food or residential. So major population is in a all day work. They have no time to give a child. So this is the major problem. So I mentioned properly. We convince our parents, we campaigning the parents to go, your child take a vaccine is the good. Yes.
No, if that is the case, first thing what is to be done by the government is awareness. Awareness should be 100%. Then only you can convince the people to go for vaccination or immunization. Otherwise, not possible. Therefore, that should be the one of the first recommendation, that awareness creation. Number 2, make it compulsory and show the impact. If you don't do vaccination, what will be the impact? For example, polio, how it will affect the children. So like that, something like that you have to promote, so that you will have mass attention of people towards the vaccination.
Could you also now, just before, show the literature review? The next page, chapter 2.
Part 1, see that something like that.
Yep. So
okay.
This was your literature review. It's 12 pages. You go through the different literature. So you didn't need to read it because I only gave you half an hour to present. Okay? So he has done the literature review. You can scroll through. Okay, Hassan has some more follow-up questions.
Yeah, I mean, mine is not just a question. It's just a general comment for all the students who are doing either your master's or your PhD. You see, the question here is, some of us, we are associated with the American University of the Sovereign Nations, and we want to be associated with a university which produces quality stuff. Because some of us have been in this field for years, and we are supervising students at all levels. So it must be something. As I said when I started asking questions, you are not writing this thing for yourself or just to get a piece of paper. To go all around, where libraries, whatever. So it must be something you say, oh, I want to be associated with this institution. So the quality of the work must also be clear. One thing which you mentioned there is a question of originality. He has been, and most of you work somewhere for years. And that is also something which can contribute to the originality of the study. Give a background of yourself. How are you associated with the research program? You've been working in a public health care institution, in whatever capacity, even if you are sweeping there, but you're part of the staff. That gives also the work originality, and makes somebody interested in reading your work. That this is somebody who is not just writing in an academic issue, but something which he is associated in terms of experience himself. Another important aspect, they kept on saying, go to the literature review, go to the literature review. The biggest problem we're facing with our students is just narrating literature, but without really giving any of your own contribution. When you just say, oh, Kaya said this, Mayashiri, Derry said this, or you're not telling me anything. You see what I'm saying? What is your own contribution to the literature? Narrating it, yes, you read around this and this, what makes your work different from what Kaya wrote, Mayashi wrote, Raji wrote? What makes it different? And that is something must also come in your literature review. And that's why the literature review including your own position there, gives your work a kind of a conceptual framework. Eh? And that's why in other dissertations you are even looking at theoretical issues. Eh? Because you're not the first person to write that piece. And there are people with different theories arising out of that issue of environment and immunization. There's so many theories arising out of that. And that must also address your work, because the theoretical framework will address also your methodological framework. There must be a link between your theoretical framework and your methodological framework, because the choice of the people who will participate in your study are informed by your theoretical framework. Eh? The choice of the instruments you are going to use to collect data. That's why when you say, I'm just going to use a questionnaire, a survey, about 296 respondents in an area which is almost 99% illiterate. How did you use a questionnaire in such a situation? And that's why we advise in such a situation, especially in developing areas like Nepal or where we come from, you do what we call triangulation, or what people sometimes call mixed methods. You can use a questionnaire for a particular group of people who can read and write. But you can also do in-depth interviews. But at the same time, you need to triangulate, cross-reference your sources of information. If you meet in my office as the director of the center, I tell you the official version. But if you meet me at Power and say, what I told you, you see what I'm saying? So you cross-reference information, but you go through a questionnaire, through an interview, through focus group discussions. You can bring a group of women, group of mothers. That's why I asked him, how do you select those people there? How do they contribute to the research program? So triangulation in terms of methodology, to cross-reference information. And you must also look at, and those socio-economic demographic characteristics, they explain the nature of your sampling procedure, they explain the sources of information. In other words, there must be a link between your background, your theoretical framework, your literature review, including your methodological framework, including the way you interpret your data. So there must be a flow somewhat in that way. The point here, we want quality work. If we also be associated with the institution, and that comes from you guys. Yeah.
Okay. Ramji, can you respond to the question and show what you think is relevant to the answer?
May I give one suggestion? Only one.
Rajendra, you can use the microphone.
I would like to just add one point that Mr. Ramji should add in geographical distribution, geographical character. In Nepal, especially in that districts, I have been there before and many times. One of the important factors is the settlement of the population. There is highly dispersed settlement over there. One house is here, and another is far away from, like 30 minutes to 1 hour. And our air facility is not sufficient in that proper area. That is another factor, and we should add that the nature characteristics of settlement and population over there too.
Go to the conclusions.
This is my one suggestion to add there.
Thank you. It's good suggestion. Also, you mentioned Ramji, hilly. So in your data, you said that the most important table was the table about the hilly linkage to the vaccination. That the environment, the hills were a barrier. So Nepal is pretty hilly. How do you define a mountain zone and a hilly zone in Nepal? Is there a definition? Is there it's based on altitude or steepness?
Yeah.
How do I define hilliness in Nepal? You're hilly, yeah? Everywhere's hilly, I think.
Conceptually and aspirationally, yeah.
Yes, thank you, Professor. 2 points. There is one, the altitude One is haze and other is very, what's they call, sleepy or
Steepness.
yes, areas. So they find out that this is hilly.
Okay. So I suggest that then maybe in the revised thesis we have a definition of hilly mountain. You've got the linkage here in your conclusions. Make it clearer which of us linkage to which specific objectives in your statement. You have 3 specific objectives, so at least a paragraph on each specific objective. My specific objective 1, this links to this. So we've got the recommendations by paragraph here, but they would like to see it more clearly, so it's easier for the reader. The recommendations probably we need to put in numbers again. You've got the comments on explain the basis of your background. Can we please always keep that door shut? Thank you. Thank you very much for closing it. So then we've got the how do your 10 years of experience make your experience unique, as Professor Kaya mentioned. That's why you chose these variables. That's why you chose to talk to people. For 10 years you're used to interviewing people, so that's common sense to you, but it's not a common sense to other readers. They don't know how. You also need, was the interview in Nepalese or was it another dialect? What language did you use for the interview? Nepalese. But if I work in some ethnic community, I may use indigenous language, yeah? If I do my research. Nepalese may not be the best language. You have some suggestions from Rajinder and Ramesh as well. Do any of you have a recommendation from your experience based on living in Nepal? What would you recommend to his work?
Sorry, I just want to say, maybe based on that, taking how Prof. Kai has mentioned, linking every section to
Please
each
use the
other.
microphone. Go. The brass band has started now.
Just like how Professor Kai has mentioned that there needs to be a linkage from the topic to the background and the background. If Ramji is going to use his personal background as part of this conceptual framework, when that particular experience, professional experience that he's had in government needs to come out in his recommendations too, because he's going to know into which policy they're talking about. He's going to know about which program he could make reference to that could be improved. So if he knows about a specific government program that is already there, he should rather make reference to that in his recommendations and saying that this should be improved, or the work plan, or the timetable or schedule of this, the awareness program that is currently in place should be, upscaled in some other way. So I think maybe, again, bringing his personal understanding of the government programs or any other aid programs, he should bring that into his recommendations.
Thank you.
Bibliography also.
The reference alphabetically, loops and tidy.
Alphabetically and chronologically.
Yep, okay. Yes, okay. Ramsey, do you have a particular reason to show this?
No.
So only show the thing you want to make a point, like conclusion, recommendation, conceptual framework. As part of your presentation is what we see on the screen. So, okay, so probably stay in the conclusions if that's what you're showing. Any comments or suggestions? Ramesh, please come up and use the mic. It's so hard to hear. Anybody else? Any comments? I said to ask tough questions, and I think he's been privileged to get tough questions. Lucky man. Okay.
It's not one-to-one.
Hills and mountains around that he haven't mentioned,
Use the mic.
and he need to mention it. I think. So when you see the mountains, when you see the thing from the Kathmandu, then it hills. So mountain is much more bigger than that. So there are places, the places he did the survey, it takes like 2 days for you to go for the immunization camp.
But the research, I mean, it's there it says, it is also to, can go to the Department of Survey or whatever, show that,
Use the microphone.
you see what, I mean, you must also be serious. You know, as he said, I mean, also I said myself, you need to operationalize, to explain, to define your concepts, both theoretically and operational. When you say a hill is high, or by how much? You can get the figure that this one is when you say poverty. If I live below, let's say, you say poor, whatever. So when you say an elevation which is, let's say, 200 meters is a hill. The one beyond that is a what? Is a mountain. So someone can put, it's like when you say, what is a domestic animal? Conceptually, a domestic animal is an animal which lives in the house. Operationally, you say a dog, or so that when I see a dog, I know it's a domestic animal. You know that? But defining conceptually and operationally. So you say it's a hill is, I don't know, 2 meters, another one, you see what I'm saying? Those 6 months, they're not simple, but they're important. Because they're doing different things.
Yesterday when
Use the microphone, please, if you're not dancing.
Yesterday when we were visiting to the school with Professor Kako, she was telling me that we were riding on the hills, but she said it's a good mountain, and I said no, it's a hill. So he needs to write what's the elevation and at what elevation he did the survey in Baglung. So I think you need to add at what elevation he did from the sea level. That's what we are talking about. That's what I want to say.
Thank you. And then, please everyone use a mic. It's so hard, and we're videoing, and our people on Skype.
Okay.
Another thing for your notes, I think you're up to page 20 now in your notes. Andrew suggested you need to define the economic terms. What is solvent and poor and ultra poor? What's the definition of these groups? And how much was economic issues concerned? As Maya mentioned about if you're farming all day, you can't take time out to go to the immunization clinic. In your thesis, you mentioned providing vaccines in the shops, for example. He also recommended to provide the vaccine whenever you go to the doctor or health clinic, any day, rather than specific days. That's one of his recommendations. So that was a thing. So you have a lot of things there. Just need to develop into the clearer in the revised version. Does anyone else who hasn't spoken have any comments or suggestions? Any suggestions?
Sociology has a small
Yes,
concern.
Rishad, please come and use the microphone. Because you have so many questions, unfortunately, we won't have time to go in the parade. But this is their own fault. Thank you. Go ahead.
Thank you, Professor. It's not a suggestion, actually a question. It's regarding the sample size formula. Z square PQ divided by D square. So as far as I knew, and somewhat, there is a bit of confusion regarding that P value among I guess some or many of the students, as most of us are students here. So at one point I knew that P is actually, that P in the formula comes from, say for example, a previous study. Say for example, if I'm doing it in Nepal. So any other socio-demographic, any other country, if I want to do it in Bangladesh, and if the socio-demographic condition is more or less same as Nepal, I can use his p-value and then use it in my formula to get the sample size. But here I saw it's regarding how many proportion or percentage were short or something, so that's brought me into the confusion of how to use the p-value. So if the professors can enlighten us on that.
Show the formula. Anybody want to be enlightening? Maya, you're very enlightening. Anybody who likes to enlighten on the p-value?
Who is good in statistics?
Okay, so maybe later we can have a discussion if... do you want to say anything on the p-value?
I would just...
Okay, go ahead. More suggestions? Please go and use the microphone. Even though for some reason they've lost their electricity too. It must have been electric, the band.
The band, yes.
So there's a blessing in the power cut. Okay. Okay, go ahead.
Good morning, all, and thank you for the presentation. So what I know about p-value is we also do a lot of research in terms of medical field. So before proposing something, we used to have a hypothesis. Okay. So which means to say that I'm using a certain drug and I propose that drug would have that benefit, and I propose a hypothesis that will help, for example, in a diabetic or a hypertensive or a cardiovascular, whatever. It acts as a hypothesis, that's one end. And another hypothesis is something that somebody says it will not have a result. So you should have one hypothesis where it is you're doing it, and another hypothesis is something that's going to be an opposite of that. You clear? So you have two things. So when you take up a study, a research study, and you work on with the progress, and during the progress you have a data value. So these data value and the one which is being done all over the world, you try to compare those along with the one that you have it. If your hypothesis is positive, you null the hypothesis, that is your negative hypothesis. That means the n is cross-bond with the n1. Okay, and you get a value. Okay, you get that's called p-value, which is a significant value of your study. Which means to say this is that unique study when compared with others, and you propose this value is counteracting your null hypothesis, and you get the value. I hope I'm clear.
It will be based on his data, so he needs to...
Yeah, you need to have a collective data. This p-value will not be same as every study. Every study will have a different p-value. That is what it is so unique. You need to know what is the significance of your study. That actually helps when you have a large data. When you have a sample size of 30 and you try to propose that this data is effective, it will not show up because other people in all around the world would have done 100 people study or 1,000 people study. So your data is validating a less amount, like, you know. It may be the best quality, but you have only 30 sample size when there is somebody who did 1,000 sample size. Okay, but so you can also defend saying your p-value is significant, because if you have anything unique in your study where you have not seen across anybody doing that, then you will have a significant result. So with that you can defend it. So your statistical report is very, very important in case of p-value, which says this is significant or not significant. If it is significant, then your results would be more or less positive or towards positive. It cannot be like absolute, towards positive. If it is not significant, your p-value would be negative.
You should include plus minus values.
Yes, yes, yes. If p-value is positive, which means it's a significant study. If it is negative, it is a minus study.
So in standard deviation, you can include this.
Yes, yeah, you need to know. For that standard deviation, you need to know the sample size, whether you're doing a control study, you're doing a case control study, and what type of multi-center study that you're working on. And all that data will give you an analysis, which type of formula that you choose. Okay, there are different formulas, whether you can use this particular study, you can use that formula, or yours, depending upon what study that you are proposing, whether it can be descriptive or analytical studies. But I feel if it is a multi-center study, you get to have different data, but make sure the sample size is good enough so that you can defend your studies. This is what I know in the syllabus. When we did our master thesis, we were put in a class for statistical analysis, and we go through a lot of books because we need to know what type of study that we are working on, and further to that we need to analyze our study, and we have to make our own formulas. That's how it is. Thank you.
Thank you very much. Okay, and in terms of, for those explaining about methodology, there are both, he talked about descriptive studies. So there are many descriptive studies, that's only one part of explaining. If you're doing the interviews to a certain selected number with an interview guide as he presented, Ramji presented the interview guide at the end, you may get statistical numbers, and we call that term quantitative, based on the numbers or making some percentage. You can only quote a sample size of 300 to roughly two figures. You can say it's 67% or 22%. You can't use a 0.33 at the end of your figure. We corrected most of these. We missed that table. So please don't show multiple figures, significant figures of numbers and results. If you only have 100 people, or 300 people, you're not going to say 67.33% of these said this. You're going to say 67% said this. Because also you have a sampling error already. And that we also have studies which are based on case studies or anthropological methods where you might do your whole master's thesis on following the progress of two people. That you are so detailed in what those two people do that that becomes your master's thesis. Okay? And you may live with them for 6 months of a life and study exactly everything those two people do. So that's a different type of methodology of knowledge, but we still can use that. And in AUSN we have all types of methodology. Okay? Another point is in the presentation, always be mindful of what you're showing on the screen and what people are talking to, and also the study. So for example, you should know there are 24 people in this room. There are 29 ants on the floor. Okay? The wall door is open to the kitchen cooking chili all the time, so please, when you go in and out, please close the door. We don't want to hear the knives and forks clattering to each other. Okay, so mindfulness is important for us as people to understand the environment and our communication, and also meticulousness in our research. Because if I see you meticulous in your presentation, I will think your research was done meticulously as well. And so it's important for all of you. Many of you are students, and some of you are professors. Secondly, good point, you did present facing to people, and you didn't talk to the screen. I dislike people talking to the screen. The screen is not listening to you. People are listening to you. Okay? So please do that. And I'd like to congratulate you, Ramji, for the hard work involved in interviewing people and traveling 2 days to the field in the hills, which for most people in the world would be mountains. I do remember when I first went to England, and in England they said, we're going to take you to the mountains. And I said, where's the mountains? I can't see any mountains. There's no mountains in this country. They said, no, this is a mountain. This is Mount Snowdon. This is Mount somebody. I said, it's a hill. It's not even a hill. It's just a mound. It's a burial mound. Okay, but why is it called a hill? Okay, and I also have a story about some of your dear colleagues from UNESCO's Youth Club when we went to the Grand Canyon to walk down the Grand Canyon, and they're wearing jandals or flip-flops, plastic sandals. And then I had some very concerned Australians and New Zealanders who are, our students as well, and they think, you need to have told these people to be properly prepared when they walk in the Grand Canyon. They have to have proper shoes, be prepared for this. And I replied to them and said, well, let's see who walks more, and let me see, by the way, how often do you normally walk in the daytime on the mountains, in the hills, and the bog? Usually I walk like this for 6 or 7 hours a day. And so we can see who survives more, even if shoes are like that. So it's a different preparedness. And when for example, I see my compatriots from Japan or Korea come to the Grand Canyon, they are prepared with wonderful clothes and North Face clothes, Kathmandu, everything, and they go for a walk for half an hour, and it's sort of interesting. Whereas the Nepalese are going with their flip-flops and shoes, and they'll walk for a few hours, and they just a morning stroll. Okay, so this is interesting, our concepts. Okay, so thank you very much, Ramji. Good job. Thank you. We have some homework to do as well in the revision, but this is the point of the presentations. We have revisions. Okay, so I'd like to, we have